Today, we're tackling a very important topic: how to lower your blood pressure naturally. This is a subject I get asked about all the time, and for good reason. High blood pressure or hypertension is incredibly common, but the good news is that we have a lot of power to control it. In this video, we're going to go beyond just listing a few tips. We're going to build a complete understanding of what blood pressure is, how to measure it correctly, and create a sustainable, natural plan to manage it for life. Hello everyone and welcome back to my channel. I am Dr. Jamalvandi, and on this channel I explain complex medical topics in simple, easy to understand language. If you don't want to miss our future content, please make sure to follow the channel and hit that bell icon for notifications. Let's start with the most crucial point I want you to remember. The truth about high blood pressure. First and foremost, I need you to understand this. High blood pressure in most cases does not have a permanent cure. It's a chronic condition. And this is a very big but that is not a reason to be discouraged. The news is actually fantastic. Someone who controls their blood pressure properly lives a life that is no different from someone who has never had high blood pressure. The risks for heart attack, stroke, and kidney disease drop down to near normal levels. So think of it not as a disease you have to get rid of, but as a vital sign you need to manage, like a car that needs regular oil changes to run smoothly for decades. The goal is control, and control is absolutely achievable. Before we begin, are you sure you have high blood pressure? This is a critical step that many people miss. A single high reading does not mean you have hypertension. Your blood pressure is like your mood. It changes throughout the day. It can spike if you're stressed, if you just drank a coffee, if you're in a hurry, or even if you're nervous about seeing a doctor. That's called white coat hypertension. So how do we diagnose it correctly? A diagnosis of high blood pressure is usually made only after several elevated readings are taken on at least 2 or 3 separate occasions. You can't rely on one single measurement. How to measure your blood pressure correctly? If you're going to manage your blood pressure, you need to measure it correctly. Otherwise, you're flying blind. Here's a simple guide. Rest first. Sit quietly for at least 5 minutes before you take a reading. No talking, no TV, no phone. Position matters. Sit in a chair with your back supported and your feet flat on the floor. Rest your arm on a table so that the cuff is at the same level as your heart, like this. Avoid triggers. Don't measure your blood pressure right after drinking coffee, smoking a cigarette, or exercising. Wait at least 30 minutes. Get the right cuff. Make sure the cuff size is correct for your arm. A cuff that's too small or too large will give a false reading. Now, let's talk about creating your own monitoring chart. This is your secret weapon, your personal blood pressure log. Why it's a game changer when you're first diagnosed or when starting a new treatment. I strongly recommend you create a log. Measure your blood pressure at consistent time. A great routine is once in the morning before medication, if you take any, and once in the evening. Record everything. Write down the date time, systolic, the top number, diastolic, the bottom number, and your heart rate. Also, note if you were doing anything unusual, like feeling very stressed. You should write it. Why bother? This log is not for me. It's for you and your doctor. It tells a story. It shows us if your medication is working throughout the day, if your lifestyle changes are making a difference, and most importantly, it helps us identify if your blood pressure is dropping too low, which is a sign that your medication dose might need to be adjusted. You should do this consistently for about 2 weeks after starting any new plan. This gives us a solid baseline. Continue until you feel confident that your numbers are under control. And even after you feel your blood pressure is stable, don't stop monitoring altogether. You can reduce the frequency, maybe check it 2 or 3 times a week instead of daily. This ongoing check is your early warning system. One more vital reminder: the absence of a headache or other symptoms does not mean your blood pressure is controlled. High blood pressure is famously called the silent killer because it often has no symptoms at all. Rely on the numbers, not on how you feel. The Natural Management Plan. 5 powerful ways to lower your blood pressure. Now, let's get to the core of it. These natural strategies work. They can be used alone if your blood pressure is only slightly elevated, or alongside medication to make the medication work better, potentially allowing for a lower dose. The DASH diet. Your nutritional blueprint. DASH stands for dietary approaches to stop hypertension. It's not a fad diet. It's an evidence-based eating pattern. First, emphasize fruits, vegetables, whole grains, and lean proteins like fish and poultry. Include low-fat dairy products for calcium and potassium. Limit saturated fats found in red meat, full-fat dairy. Reduce sodium salt. This is the biggest lever you can pull. The goal is to stay under 2030 milligram per day and ideally closer to 1500 milligram. How? We have a video in the channel that I put it on my top. You can click on the link and you can understand which type of salt it's better to use. How? Cook at home more often. Read food labels. You'll be shocked at how much sodium is in bread, canned soaps, and processed snacks. Use herbs, spices, garlic, and lemon juice instead of salt to flavor your food. Move your body. The power of exercise. Aim for at least 30 minutes of moderate intensity exercise on most days of the week. That's just a brisk walk, cycling, or swimming. How it helps? Exercise makes your heart stronger. A stronger heart can pump blood with less effort, which means less force on your arteries. It also helps with weight management and stress reduction. Manage your weight. The number one link if you are overweight, losing even a small amount of weight, just 5 to 10% of your body weight, can have a major impact on your blood pressure. Shedding extra pounds takes a tremendous strain off your heart and blood vessels. Limit alcohol and quit smoking. That means no more than 1 drink per day for women and 2 for men. More than that can rise blood pressure significantly. Smoking. Every cigarette you smoke causes a temporary spike in blood pressure. Over time, the chemical in tobacco damages the lining of your artery walls, causing them to narrow and harden. Quitting is one of the best things you can do for your overall cardiovascular health. Conquer stress. The mind-body connection. Chronic stress keeps your body in a fight or flight mode, which can elevate your blood pressure. Find healthy outlets. Practice deep breathing for a few minutes each day. Try meditation or yoga. Make time for hobbies you enjoy. Ensure you're getting enough quality sleep. Poor sleep can wreak havoc on your blood pressure. The kidney connection. What you need to know: many of my patients ask me, "Doctor, why do you always check my kidney when I have high blood pressure?" It's a two-way street. High blood pressure can damage the kidneys. Your kidneys are like a sophisticated filter system. Filter with tiny blood vessels. Consistently high blood pressure can damage these delicate vessels, making the kidney less effective at filtering waste from your blood. This is called hypertensive kidney disease. Kidney disease can cause high blood pressure. The kidneys also produce hormones that help regular blood pressure. If the kidneys are damaged from another cause, like diabetes, they can't do their job properly, which can lead to high blood pressure. So it's a critical cycle. When we see high blood pressure, we must check the kidneys to see if they are the cause of the victim. Managing your blood pressure is one of the best ways to protect your kidney health for the long term. Final summary and take home message. Let's bring it all together. High blood pressure is for life, but it's highly controllable. A well-controlled life is a healthy, normal life. Diagnose correctly, don't panic over one high reading. Measure it right and keep a log. Especially when starting treatment, this is your date, your power. Embrace the natural strategies, the DASH diet, regular exercise, weight management, and stress reduction are powerful medicine. Understand the kidney connection and protect those vital organs. Management your blood pressure is a marathon, not a sprint. It's about making consistent, healthy choices day after day. You have the power to take control. Know that you know how to control high blood pressure. It's crucial to understand what happens if it's left uncontrolled. In our next video, we will be talking about the complications of a high blood pressure, the real-world effects it can have on your heart, brain, kidneys, and eyes. You don't want to miss it. I will put the link to it here as soon as it's live. To make sure you see that video and all our future content, please follow the channel and click the bell icon. If you have any question, please ask me in the comments below. I do my best to read and answer them. Thank you for watching. Stay healthy and I'll see you in the next video.